What I want to know is like, as you explained previously, there are some scams currently happening in the market. These sort of MBBS, and I don't know, like these type of like specialization, medicine studies, and such things. There are many agencies which are promising fake things, making fake contract stamps, and forging things. So, can you take us through example, or what things do we need to be careful, and what things we should look for when we are looking for an authentic university, consultant, or agency?
So basically, the promise is that you will get your degree recognized from Slovakia. You will then do some specialization training, and then you move to countries like Germany, Switzerland, Austria, as you can see in this page. Yes.
Yes, it's written.
Yeah. So I just deleted the agency name, but you will see it in very different types of the logos. So basically, here you can see, for example, all specialization, residency with salary, and so on. Residency is one special part of the specialization in Slovakia. It means if you complete residency, you are paid, you will need to stay in Slovakia and work maybe 5-7 years as doctor, medical doctor, because government was paying for your salary during the specialization process. So it doesn't make sense even residency, like how someone can go for a residency in Slovakia if he or she has obligation then to stay in Slovakia. There is no school that will or hospital that will prepare you in German, in Swiss or Norwegian, because why would they do it? Yes.
Yeah,
Why?
they won't teach you in English. They will teach directly the students in the local language itself.
Yeah, like specialization is only in like it's never in any other language. It's only in Slovak. Yes, because of course, like if I study in German, like then what's the benefit for the government if we need doctors also? Yes.
Yes, obviously.
License to practice in Europe. This I discuss also with, like then I will mention also the links below the video. But this is also not that easy to recognize your specialization from Slovakia in other countries. Even in Germany, different cities can be having different rules for recognition. In Sweden, for example, they told me you need to practice at least 1 year in Sweden before you can do the specialization in Sweden. So again, it's not automatic. Yes, it's like again very complex. And now,
So what about, for example, if someone already has a specialization, let's say done from Slovakia, then is the license valid all over in Europe, or is it then also it has to be re-recognized in every country we move?
okay, so again, like it will be different in every country. Because, for example, if you want to go to Sweden, at the beginning you will be under some supervision of some doctor, and you will need to go to Swedish language school, and you will need to practice like Swedish medical Swedish. It's like it doesn't work like you come and next day you can work in some Swedish hospital because everything will take some time. It can be different from country to country and even from city to city. Sometimes they might be okay, sometimes they might ask you for doing some extra exam for specialization for specialization before they are sure that you can okay you can work as specialist in that country.
Actually, I see over here, for example, even remuneration that they have mentioned it in a way that how, for example, in many of like non-European countries, it works that during course you will get some sort of like internship, like a traineeship, then you get a residency, you get salary, and then you have placement. They have mentioned it in that way, but it's not the same way how it works in European countries, right?
Yeah, like okay, so let's say during course, like basically the course is like during the employment. Like if you are preparing for specialization, you work in some hospital. So basically, it's full-time job. This number, okay, let's say it might be maybe a few hundred euros less, but with the night shifts, maybe it will be 12, 1300 euros. Okay, let's say. On a residency, again, residency only people with the permanent residence in Slovakia can do. And again, this is not realistic. It will be maybe 1,500 euros. But again, after you finish the residency, you need to stay and work in Slovakia. In this page, and also like the specialization, as we discussed, it's not 18-month program. Yes, it will take 3 to 4 years. So that you can count like this 36 to 48 months. So we can calculate it. So this is one mistake. This is second. Not all specializations are offered. Residency only will permanent residence. Language course, okay, just in Slovak. And so so far we have maybe 4 big mistake. Residence, it will not be 3 to 4,000. And placement, okay, that could be true. Maybe in Germany, Finland, and so on, you might be getting this amount. So basically, the offer is telling that you can come to do specialization in Comenius University. And then do this specialization. Basically, the part of the like the position of the faculty is, let's say, the faculty is something like guarantor, that you are getting the correct information and you are preparing in a right way. But in the end, most of the training is done solely during your internships in the hospital. Yes, so you are some exams, like the university faculties are supervising, but it's not course of the university. It's specialization which is done by hospital, but in relation with the faculties. But it's not course in the university. So everything, really everything is in Slav language. So it doesn't make any sense. How can you select language according to the country?
It's impossible.
Yeah.
Yeah, you study in German language for specialization in Germany. That's impossible.
Like that's, I don't know if I ever met anyone from Finland in Slovakia apart from the hockey championship. Yes. Who would even give this training?
Yeah, that's the thing. The professors have to, or the hospital has to be speaking, let's say, Finnish or German in order to get a German specialization in Slovakia.
Yeah. And again, this is another like false information. Like there is no entrance exam for the program. Like how can you go for full-time contract, full-time job, and like how can you even take the entrance exam? Yes, like basically you go for some interview with the hospital, but it's not course of the university. It's normal full-time job which you do at hospital, and then proceed for the specialization. So from this leaflet, it sounds like it's some university program, but it's not. It's very misleading information. So now we are getting to the history of the Comenius University. And I spoke also to Faculty of Medicine study office in Bratislava. They said like, it's definitely not their offer. And then I spoke also to this faculty, and they told me very precisely that it's not their offer from the reasons which I mentioned. That you cannot do it in English language. They do not provide any course like that. It's not even course because of everything that was mentioned. Basically, the offer is that you will do this specialization at medical Jesenius Faculty of Medicine, which is in Martin. It's part of the Comenius University, and it sounds like you can do specialization in all these fields. But when you compare it, again, like the link will be below the video. There are like many programs which are not offered by this faculty as specialization, even if you do it in Slovak. So, for example, cardiology, it's not offered. Then endourology is not offered in Martin, and endodontology is not offered. Emergency medicine is not offered. Family medicine, that's I don't know, maybe they taught like pediatrics, but family medicine is also not offered. Or for example, this ortho-oral surgery, it's also not offered of specialization. This might be that in some other faculties that's possible, but definitely like faculty will not give you any confirmed placement. Basically, it's your responsibility to find placements and then to ask the faculty to be supervisor during your specialization.
Yeah, I think it's impossible that anyone guarantees a particular job, because it is something that has to be on own will and own, let's say, work. Like the faculty never guarantees a job.
Yeah,
They
of course.
can help you, but they won't guarantee it. With like how 100% like promises are written, it's impossible to show it in that way.
Yes. So, and again, we are getting to this part. Okay. So first of all, when you work as doctor full time, then it's illogical that you will be getting part-time salary. That's illogical. Like, how can doctor be part-time? Yes, especially when like there's shortage of doctors. Like, how can you be part-time doctor in specialization? Residency, as we were discussing, that's again not realistic. Like, you will maybe get around 1,500 euros. No, there are so many illogical and uh, even not legal information. So basically, I will just finish this story. Maybe 2 weeks ago, like there was one guy who completed his degree in Moldova, and he said like he got like he sent me exactly this leaflet we just saw before, and he told me that he's getting offer that he can now do this specialization in Slovakia. So I told him, okay, I checked with the faculty. I told him, I showed him even the email, and I told him no. He could see from the study office that this is not our offer. It's not legal what is written here, and there are many mistakes.
Yeah.
Next day, he sent me some confirmation which we got from that agency, claiming that there is already some doctor who got enrolled to this course. So I called to that lady, and she called me, and then she wrote me email that no, this is not paper which I signed. It's forged letter. There is no confirmation which I gave anyone that he or she is enrolled to any program. And she said like she will need to contact the criminal police.
And this is from the embassy.
No. This was done by like one HR person from the hospital in Bratislava. Like there was her signature and some stamp. And there was even email which was like not matching with the position. So, but I phoned her and then I called her, and she said, "No, this is not like I didn't issue any letter like this." So then she even sent me email, "No, like please be aware of this offer. It's like not coming from our hospital, and not from me, of course." I saw somewhere even the pricing, it was maybe starting with 2 to 15,000 euros. Like every
I
step.
mean, like the services for their consultation.
Yeah, exactly. So firstly, we'll get some confirmation, and then this. So totally, like the price was maybe 15,000 euros. So basically 15,000 euros, and in the end, you come and see, okay, but I need to learn Slovak. I need to pass all exams in Slovak. I need to pass Slovak proficiency test. Only then I can enroll for the program. So I thought it would be really helpful for people who will get this offer not to go for it, because it will be big loss, and also loss for like reputation of Slovak hospitals and Slovak universities.
It's like the MBBS or the general medicine degree is very open for internationals to come in, study, go back to their country, or stay here and practice medicine. It's also open for someone who wants to come over here and practice it and maybe learn a little bit of Slovak, because they have to interact with patients. But once they want to do the specialization, it's better they choose a country that they want to further stay and work in, because they will be doing all the paperwork there, they will be doing all the practice there, and also the studies over there. It's not good idea like just go and work placement, some sort of like magical fairy tale. It is not something like that.
Exactly, yes. If they want to go to Sweden, they should first discuss with them, learn local language. But like this, it looks like shortcut, but in the end, it will be just losing a lot of money and effort.
Yes. Yeah, it can be obviously a lot of issues with the specialization if someone is not planning to stay particularly in Slovakia and work over here. But with the MBBS, it's quite open for everyone to come in, study general medicine, work here, work somewhere else, and things like that.
Yeah, definitely. Yes.
Okay, thank you so much, sir. Thank you so much for all your inputs and all of this really valuable information. I think in the future also we'll have a few more episodes about all of these sort of information with different study streams. Apart from the different videos we are having with career prospects and all, we will also have some study related, these type of informative videos. What do we need to be careful about? What are the procedures? What do we need to look for while studying in the Schengen zone, in the let's say in Slovak Republic? So thank you for all of this, and thank you to all of our viewers for watching this video, and hope you liked it. Please give it a like button, share it with your friends and peers who are planning to come to Europe to study, planning to study medicine in general. Share it, share the thoughts with them, and also let us know in the comments if you have any queries, if you want to connect with universities, with Mr. Zawadzki, with any sort of paperwork guidance that you require. We'll be happy to answer. Thank you so much, and thank you for watching again. Until next time, do widzenia.
Do widzenia.